want to work, as your report shows. It's bad for employers who are desperate to recruit. And it is bad for our public finances too. The OBR says spending on sickness and disability benefits is set to increase by £30 billion over the forecast period. Imagine what just a fraction of that money could do instead. The second problem we face is that far too many people are stuck in low-paid, poor-quality work. Only 1 in 6 low-paid workers ever fully escapes into better-paid work. Many are in insecure jobs with unpredictable working patterns. The result is too many people are in poverty despite being in work. Too many people lack power and control over their lives, and it leads to stagnant productivity, which is holding our economy back. The third major problem is that after 14 years of the Conservatives, nearly 1 million young people, a staggering 1 in 8, are now not in education, employment or training. That is up 90,000 in the last year alone. Young people struggling with poor mental health and lacking basic qualifications face the greatest disadvantages. Each and every one should have their whole future ahead of them. But under the Tories, they have been written off before their careers have even begun, with all the long-term consequences we know that this brings for their future job prospects and earning potential. Now, these 3 challenges, I feel, are a damning indictment of the last government. They are all far worse in parts of the Midlands and the North, which have borne the brunt of Conservative economic failure, just as they did in the past. And they show the scale of the challenge that this new Labour government must now confront. So why have we ended up here? The causes of the problems we face are complex. In part, they reflect the impact of economic, social and demographic forces affecting our country. But I am convinced that the approach taken by previous Conservative ministers at the DWP has harmed people's capacity to cope and thrive in the face of the challenges and changes we have in future. The fundamental problem is that the current system of DWP, job centres and other employment support is almost entirely designed to address the problems of yesterday, not today, tomorrow. We must, and we will, do everything to keep unemployment low. The Labour Party was forged from the struggle for jobs and the fight against unemployment. But the most urgent challenges today are different. They're about how we deal with spiralling inactivity, driven by the fact that we are an older, sicker nation. They're about how to ensure all young people get the education, skills and job opportunities they need to kickstart their careers. And they are about how we enable people, whatever their age, to have decent pay and the chance to build a career and to benefit from good work that gives them the chance to thrive. The Tories completely failed to address these challenges. Over the last 14 years, their approach at DWP was focused almost entirely on the benefit system and specifically on implementing universal credit. They turned Job Centre Plus into a benefit monitoring service, not a public employment service, which was its original aim. And they paid nowhere near enough attention to the wider issues like health, skills, childcare, transport, that play such a huge role in determining whether you can get work, stay in work and get on in your work. The result is a system that is both too siloed and too centralised. We fail to properly join up health, work and skills, and we aren't rooted in local economies and driven by local needs. And in terms of improving job quality and promoting good work, the Tories almost entirely vacated the pitch. But I think there is another final reason for the state that we are in. And that's because the Conservatives put political point scoring ahead of solving problems. Their divisive rhetoric about strivers versus scroungers, or claiming people just felt too bluesy to work, may have grabbed headlines, but it did absolutely nothing to actually get Britain working again. As today's report rightly concludes, people who are economically inactive are not one single group. There will be a few who may act fraudulently, others who say they can't work but who can. But the vast majority face a complex range of barriers which stop them from getting what both they and policymakers want, a pathway into paid employment. Now, I believe in personal responsibility. Under this government, there'll be obligations to engage with support, look for work and to take jobs when they are offered, as there have been since the original Beveridge report was put into practice. But I am in politics to solve problems, not score cheap points or grab empty headlines that do nothing to tackle the real problems in people's lives. So, unlike the Conservatives, this new Labour government will be driven by the evidence and by the facts. As our new Prime Minister says, no more politics by performance, no more sticking plaster solutions, but a serious government with a serious plan for a decade of national renewal. This starts with a new focus and fundamental reform of the DWP. Put simply, under my political leadership, the DWP will shift from being a department for welfare to being a department for work. And to make this real, let me set out the actions and reforms I am setting in train. First, new goals. As Keir Starmer said during the election campaign, this Labour government has a bold, long-term ambition to get an 80% employment rate. Currently, that would mean over 2 million more people in work, growth boosted by tens of billions of pounds a year, and a multi-billion-pound a year boost to the public finances too. We will pursue this ambition alongside our wider economic goals to raise productivity and living standards and to improve the quality of work as part of the government's growth mission. And our employment support system will change the outcomes we seek to achieve, and that's about higher engagement, higher employment and higher earnings too. Alongside these new goals, there will be fundamental reform in 3 connected parts. First, a major overhaul of our job centres. Only 1 in 5 people who are looking for work say they use a job centre. And as Alan said, only 1 in 6 employers who need staff use them to recruit. This actually drops to 1 in 10 for SMEs, which we know are the lifeblood of our economy. So this must change. We will create a new Jobs and Careers Service by bringing together Job Centre Plus and the National Careers Service, focusing on helping people not just to get into work, but to get on in their work, not only on monitoring and managing benefit claims. Our new service will mobilise the potential for new technologies and AI to better help people who are looking for work or wanting to develop their careers. And it will enhance and improve support for employers too, which your report says is critical. Second, we will establish a new youth guarantee to offer training, an apprenticeship or help to find work for all young people aged 18 to 21. And today, I can confirm that we will empower mayors and local areas to take the lead in driving down economic inactivity and driving up economic opportunity, taking inspiration from the brilliant report we are here to launch today. Devolving powers from central government is key to enabling areas to deliver ambitious new local growth plans. And as part of this, we will give local places the responsibility and resources to design a joined-up health, work and skills offer that's right for local people. Our aim is nothing less than a fundamental shift in the balance of power and resources to local, so that our mayors, councils, the NHS, businesses, colleges and the voluntary sector can work together to deliver real employment opportunities for local people. My department will support local areas to make a success of this new approach starting by devolving new powers over employment support to catalyse action and change. Because the man, or even woman in Whitehall, will never know what's best for Barnsley, Blackpool or Birmingham. To deliver these changes and our manifesto commitments, we will be producing a white paper to get Britain working soon. This will support the other steps we are taking across government, creating more good jobs in clean energy and through our modern industrial strategy, improving the quality of work through the New Deal for working people, cutting NHS waiting times, improving mental health support, particularly for young people, and transforming skills and childcare so we tackle the root causes of worklessness and fix the foundations for work, not simply paper over the cracks. And unlike the previous government, we are committed to working across Whitehall to tackle these complex problems, which is what our new mission-driven government is all about. Now, let us be honest. These new goals and reforms that I have set out will require the department I lead to make a very different contribution in the years ahead. Under my leadership, the DWP will continue to be a major provider of employment support through the National Jobs and Careers Service. But we will also need to be a driver of innovation, experimentation and learning to develop new solutions to complex problems and to build the evidence base, just as your pilot seeks to achieve. We'll need to be a capacity builder, working alongside local areas to create the conditions for success, including, and this is essential, sharing and unlocking data. And we will be a guardian and champion of quality, outcomes and user experience and value for money. This is a hugely challenging but exciting agenda for radical public service reform. And to help drive our work, I can today announce that I will be establishing a new Labour Market Advisory Board, a group of leading labour market experts to provide me and the department with insight, ideas and challenges as we deliver a fundamentally new approach. And I'm absolutely delighted that Professor Paul Gregg, former director of the Centre for Analysis of Social Policy at the University of Bath, has agreed to lead this new advisory board, and will be announcing further members shortly. I'm under no illusions about how big a change this will be. It can't happen overnight, but we can and we will roll up our sleeves and make a start. So if you're a young person with a mental health problem or lacking basic skills, we will help you reach your potential. If you are disabled and want to work, you'll get the respect and support you need. If you're a mum or caring for an elderly relative, we will be there with practical help so you can balance your work and family life. If you're an employer who needs to recruit or wants help to keep staff in work, we will support you, we will back you and help you find your next star employee. This is what we will deliver to get Britain growing again, get Britain building again, and to get Britain working again. Thank you.
As I said to you earlier, we've been waiting 14 years. Well, it's been well worth the wait, I can say. We've now got time for some questions from the floor, but we'll begin with the press and media. So our first question comes from Sophie Huskisson from the Daily Mirror.
Hi, Sophie from the Mirror. So today you heard a lot about a high proportion of people off work having contact with employment services. So to hit that employment rate target, do you have plans to force all people on long-term sick to have some form of engagement with employment services, or if not, another form of services, say mental health services? And then just a quick point on flexible working that Alan mentioned as well. We've seen lots of successful trials for 4-day working week. What's your view
Well, we're not proposing a 4-day working week. We do want to see greater flexibility in the workplace, and anyone, I don't know if anyone's an employer here, lots of good employers know if they can be flexible for families, not just people looking after kids, but elderly parents, and sometimes both at the same time, or if you have fluctuating health problems. Actually, flexibility helps you retain those staff and skills. It helps you recruit staff and skills. That's better for them, and it's better for the bottom line. And, you know, Alan's report and the Barnsley report today proposes that everybody should have a requirement to engage with the system. That's not what we're proposing, but I'm very keen to learn from the Barnsley experience here to see what changes. The most interesting things about this report, you know, because it actually spoke to people, it didn't label them, was that this 7 in 10 said they would like a job now or at some point in the future if they could find something that fitted with their lives and skills. I think that's a big opportunity for us in future, and that's something we want to work with local areas to develop. Thanks, Sophie.
Okay. Our second question is from Martina Bett from the Sun.
Thank you very much. You and Ms Milburn both mentioned that the problem with the previous government is that it has focused too much on a separate sanctions regime instead of looking at wider issues like health and transport. I think Ms Milburn mentioned that there should be a better balance between sticks and carrots. But just confirm that under this government, you will still impose tougher universal credit sanctions, which would see people being cut off support altogether if they do not comply with efforts to get into work.
I mean, the problem with what the Conservatives proposed was after 12 months to do this. We're not leaving people 12 months without genuine engagement and support. And there have always been conditions to look for work and consequences if you don't. That won't change. But I want to see a much greater focus on that upfront help and support. I think it's an entirely wrong framework to look at this out. People are crying out for help and support. As the report says, there are a few who will be acting fraudulently and others who say they can't work when they can, but the overwhelming majority want that help and support, and that's what we're determined to deliver. Thank you.
Okay. Our third questioner is Nick Guttridge from the Telegraph.
Hi there, thank you. In your speech, you said that too many people are economically inactive within labels and then blaming to the position they're in. Was that a direct deviation of your predecessor's approach to essentially like that it's now too easy to be sort of signed off work with milder mental health conditions? And obviously the previous government had come up with plans to reform the based on that argument. Are those plans now completely dead in the water? You're not going to go ahead with those?
Was it a rebuke of the former government? Yes. And look, we need to. Alan made a very important point here, which is that whilst we talk about a lot, rightly so, about the people out of work, there are many people who are in work but are at risk of falling out. And there's a really, really big problem, which is that if you don't provide them with help and support early on, they're likely to stay out of work for a long time. I'm a bit long in the tooth now, referred to as a veteran MP recently, which I'm very proud of. But I remember when Jeremy Hunt proposed reform of fit notes when he was Health Secretary. You know, I'm not interested in repeating failed plans. I'm interested in new action. And our white paper is going to work and engage with employers about precisely these issues. How do you keep people having that link to work? Our reforms, I think, to statutory sick pay as part of the New Deal for working people will be important there. How do we ensure we have a decent system of occupational health in this country? And how, crucially, do you act quickly? Because you need to keep those connections to the world of work.
Okay, thanks, Liz. We'll go on to Alex Taylor from Globe.
We will take other questions from the audience as well. I'm sorry, but this is, you know, hi. Hi, Alex.
You mentioned about a sort of reform of the jobs and how much work will go into that, and is there a sort of time frame when that would be in place for what it would be that you want to look at?
I want to make really clear here that I think we have some amazing work coaches in our job centres who bust a gut to try and help, but they're sort of constrained by this top-down system. And many of them really understand that these sort of weekly, fortnightly mandatory assessments is the only kind of approach that doesn't give people the time or the links that they need, isn't really working. And if you go to see the other parts of the country and what they're doing, you know, if you listen to Andy Burnham in Manchester, he just says people are referred to our work projects by the job centre because they don't have the time to do that. So what are they focusing on? It's a big set of changes. It won't happen overnight, but we are getting going straight away. And our white paper, which we'll be publishing as soon as possible, will set more details on that. But if there are any work coaches watching or listening, they've got loads of ideas, experience. I want to use that to really reshape the future of job centres because I know that's what they want to do. Thanks, Alex.
Okay, Peter Lane from Channel 5. No, Peter not with us? Okay, we'll move on to Tom McDougall from the BBC.
Hi, Tom.
So, do you agree that it's time to replace sanctions in the welfare system with better targeted support to help people back to work? And I recall this one when they say scrapping the two-child cap is the single most cost-effective way of alleviating child poverty.
Well, as I said in a previous answer, there will be conditions in the system and consequences if they're not met, just as there always have been. It's really interesting reading the original Beveridge report where that is made clear right from the start. But I think we have had too much of a focus on that rather than on the help and support people really need to get into work. And on the issue of the two-child limit, you know, I think this is one of my absolute personal priorities, is tackling child poverty. I ran the Maternity Alliance charity before I became an MP. I know the impact that poverty has in the earliest years of life. We have set out immediate action. The Prime Minister has launched a big new cross-government task force on this to deliver a new child poverty unit in the Cabinet Office. We are faced with a dire economic inheritance from the last government. We will only make commitments when we say how we can afford them. But let me point you to the last Labour government, which lifted over 500,000 children out of poverty, compared to the last Conservative government that plunged 700,000 more children into poverty. I know which side I stand on. Thanks very much.
Okay, well, Liz has agreed to take 2 or 3 questions from the floor from elsewhere. So, would someone like to raise their hands? Yeah.
Thank you. Nick is from the University of Sheffield.
Oh, great.
One of the issues that you kind of touched upon is the issue of workforce and people getting back into work. I also wonder whether you might actually reflect or talk a little bit about your thoughts on specific policy tools that regional and local authorities can make to create those better paid, more stable jobs, but also to upskill people that are already in the labour market as well.
Should we take a couple so that we can get as many in as we can? Is that all
Any
right?
more raised hands from anyone? John?
Thank you. One of the drawbacks with employment, particularly in the care sector, is zero contract hours.
Yeah.
Have you got any thoughts about reforming that? They're like on a merry-go-round, you know, changing from one company to another because they can't get a set amount of hours. Have you got any thoughts?
Okay, the lady here.
Yeah, from the States from the Pensions Secretary. So the increasing mental health which is being highlighted is one of the symptoms something underlying. I'm just interested in how far back you were going to actually look for the
Yeah.
yourself is not a root cause, it's the symptoms.
3 really good questions. Whether it's on our local growth plans that we've talked about, which will be a big change to what I've said today about those being underpinned by local work, health and skills plans, joining up all the myriad pots of money and different organisations who are involved all into one place. I see this really, really clearly in my own city. We want to put local mayors and combined authorities and local council leaders in the driving seat of change there. It's really interesting hearing this discussion about the issues in Barnsley. In Leicester, actually the main reason driving inactivity, economic inactivity in my city is having responsibility for caring for a family member. That may be many older generations, living in multi-generational, because we have a very diverse community, lots of multi-generational homes, but also my job centre tells me we have lots of real issues around lack of childcare, particularly for single parents who desperately need it. So that's why what I really mean is, I know what Leicester needs. I don't know, I mean, I do now because I've read the report, but you can't possibly run it for the centre. So what we see is those local growth plans underpinned by bringing together the work, health and skills plans. It's the only way that we're going to drive change. On zero-hours contracts in social care, before I was lucky enough to get this job, I've spent sort of 20 years of my life working on health and social care and was the shadow social care minister. So it's a huge, huge problem. And we've said as part of the New Deal for working people that we will ban exploitative zero-hours contracts. We also really want to have a fair pay agreement for social care staff so that we can really start shifting it. And you know what? The NHS knows that actually they need a decent social care workforce. We've got to stop seeing the two systems separately. You've got hospitals full of elderly people who don't need to be there, but you've not got the social care staff that we want and need. We've got to start working together. And on mental health, you rightly say the links between mental health and social and economic factors are really important. I think this is a really important and complex issue. There is less stigma around talking about mental health, but we're also actually seeing higher diagnosis rates too. And I do think the pandemic had a real impact on the mental health of younger people. So we need to, I think the real focus for us has got to be to get the support early on. We know half of all serious mental health problems start when people are very, very young. So we need to get the mental health support into schools, into local communities. We've got big plans around that, recruiting 8,500 more mental health staff and new open access hubs in every community. But we know only too well the links between poverty, deprivation and mental health too, which is why Wes Streeting, our new health secretary, he's a huge supporter of the agenda we're talking about. He knows that as well as cutting waiting times, shifting the focus of services towards prevention, he wants to look at the role the NHS and social care will have in boosting social and economic outcomes locally. Let me just finish by saying this. Before the election, I visited South London and the Maudsley Mental Health Trust, one of the biggest mental health trusts in the country, currently chaired by Norman Lamb, who's a former Liberal Democrat minister. He is fundamentally reshaping the care in the hospital because the evidence that good work is good for mental health, that it reduces the number of relapses people have, it reduces their length of stay in hospital, that skills, employment, training, opportunities is actually treatment. It's actually helping people have better mental health. I think there's lots more we can do on this agenda, and I certainly intend to be working with Wes Streeting to deliver.